Hello, my name is Diana Goodwin, and I will be discussing how the implementation of the Global Initiative for Chronic Obstructive Lung Disease recommendations for diagnosing and managing COPD can impact unplanned COPD readmissions. COPD is a progressive disease that causes structural changes within the lungs. It is a common disease process that is both preventable and treatable. However, once the structural changes begin, they are often irreversible. The most common cause is the smoking of tobacco products, but environmental and occupational contacts, such as exposure to blowing dirt, smoke, chemical, and gases, can also cause COPD. According to the CDC, 15 million people in the United States have been diagnosed with COPD. Current estimates indicate that the total number of individuals with COPD may be twice that number. In Texas, those over 65 years of age are the most affected, with 11.9% of individuals between 65 and 74 years of age and 14.9% of those over 75 years of age impacted by the disease. Locally, the mortality rate for chronic respiratory disease has increased from 4.3% in 2008 to 4.8% in 2013. In 2001, the GOLD Committee published its first recommendations. These recommendations underwent a major revision in 2011 and have been updated regularly based on ongoing systematic review and new knowledge and treatments. It is recommended that anyone with some combination of chronic cough, shortness of breath, sputum changes, a known respiratory impairment, a history of tobacco smoking, or exposure to indoor or outdoor environmental concerns such as blowing dirt, smoke, or chemicals be tested for COPD using pulmonary function tests. A ratio of the forced expiratory volume in 1 second to the forced vital capacity is less than 80% is considered predictive, and less than 70% is considered diagnostic. Management is then individualized based on the extent of airflow limitation and the impact on the individual's health status. Management includes smoking cessation education, individualized pharmacological therapy, obtaining the flu and pneumonia vaccines, pulmonary rehab, referral after exacerbations, and oxygen therapy as needed, including non-invasive ventilation. Two PICO questions guided this literature review. The first was, in adults with COPD or COPD exacerbation, does the implementation of GOLD recommendations compared to usual discharge planning decrease 30-day unplanned readmissions? And second, in adults with COPD or COPD exacerbation, does implementation of the American Lung Association's COPD action plan compared with usual education increase confidence in self-management ability? This review includes 2 systematic reviews, 4 randomized controlled trials, and 1 controlled trial without randomization. There was little in the literature explicitly considering the GOLD recommendations as a whole. The majority of studies reviewed implemented interventions, including at least one of the recommendations. Burke et al. Examined how the 10 domains of the ideal transitions of care model impacted self-management of chronic disease as a whole within current literature. It was found monitoring and managing symptoms after discharge was statistically significant, and that patient education and social support were found to be clinically significant, supporting the inclusion of the individualized education and planning associated with the COPD action plan. DeRege et al. Was unique in that it reviewed the role of the hospital in the transition of care. My project is hospital-based. This study identified the greatest risk to continuity of care occurs at transition points and found hospitals can play a pivotal part in ensuring smooth transition of care, which could decrease unplanned readmissions. Bucknall et al. Closely examined self-management support and education in a randomized control trial. This intervention provided follow-up care after discharge. Although no major impact was found in relation to unplanned readmissions, A sub-analysis showed participants identified as successful self-managers showed significantly improved quality of life compared to unsuccessful self-managers and those in the control group. Younger participants and those with support in the home were most likely to be labeled a successful self-manager. Earlier diagnosis could be key in reducing long-term impacts of the disease. Despite the use of many of the GOLD recommendations, the Fan et al. Article was excluded from review as it was discontinued early due to an unexplained mortality increase in the intervention group. In Garcia-Amarich et al., clients were given an individualized action plan, and this plan was also given to their primary care provider. They also received a comprehensive 2-hour education session covering medications, inhaler use and technique, dietary considerations, smoking cessation, and encouragement of physical activity. No effect was found in pulmonary function or lifestyle, but improvements in body mass index and early identification and treatment of exacerbations were not only significant, but found to persist over the 12 months of the study, indicating that a shorter, intensive, comprehensive education session may be as effective as shorter targeted sessions over a longer period of time. Langskak et al. Found that the use of a discharge planner facilitated the transition from acute care to the home settings and decreased COPD and all-cause unplanned readmissions. Finally, Sui et al. Is the only study identified which examined full implementation of the GOLD standards in those with frequent COPD readmissions to determine potential risk factors for acute exacerbation. Non-invasive ventilation and the number of exacerbations in the previous year were found to be statistically significant, along with anxiety in predicting unplanned readmissions. It is speculated anxiety could be the cause of some of very frequent readmissions rather than physiological exacerbation, supporting the need for treatment of comorbidities, particularly as the disease progresses. The fact that 4 out of the 5 Level 2 and 3 studies included in this review took place outside of the United States indicates that this problem is of international importance. Literature explicitly related to the implementation of the GOLD recommendations is lacking, supporting the need to further examine the potential impact of broader enactment on COPD management and treatment. The most effective educational components include self-management techniques and inhaler technique and adherence. The use of an individualized action plan on early identification and treatment of exacerbations to reduce unplanned readmissions was strongly supported. Specialty care, pulmonary rehabilitation in this case, was also supported, and the identification of risk factors specifically related to exacerbation were identified. This has great potential to help healthcare providers recognize those who have the greatest need of intervention and help tailor our education more specifically for them. Thank you for listening to my presentation. References for this presentation can be found on the next 2 slides.